Welcome. I'm Shivan Sarna, and I founded a company called Chronic Condition Rescue. And under that umbrella, which was founded because I had so many things wrong with me back in 2015, I can't believe it's 10 years now. I have really leaned into gut health, to SIBO, small intestinal bacterial overgrowth, 11 online summits, including menopause, liver, gallbladder, fascia, lymph, biological dentistry, gut, all kinds of things. And I've had a really privileged relationship with Microbiome Labs, the creators of Megaspore and a variety of other very special products that are evidence-based. And as a result, we've been able to do monthly webinars with their scientific officers, really. They're researchers, they're educators that go around the world and educate other practitioners. It's such an honor today to have Jenny Olson here, who is going to be talking about enzymes and how their role in the body, and how it's one of the easiest and first line therapies that we can all do. And I think it's one of the most overlooked. So she is the clinical science liaison for Microbiome Labs. She is a board certified holistic nutritionist. She still has a practice. So she's got a lot of clinical pearls to share with us, in addition to a lot of great research and some new information that I know you're going to be happy to have. With that, I'm going to hand things over and let you get started. So thanks everybody for coming, and I'll see you on the other side of the presentation. Again, questions go in the Q&A box, and I'll talk to you in a sec. Okay, go for it, Jenny. Thank you.
Thanks so much, Shivan, and thanks for such a warm welcome. And welcome, everyone. Thank you for joining us, and wherever you are, whenever you are. And I'm glad to be here with you, just sharing some education on digestive health, as well as some exciting updates on Microbiome Labs with a new addition to our digestion repertoire. So with that, we will get right into it. We're going to be reviewing some of our digestion foundations, highlighting structure function of our enzymes, going over various ways that this normal and healthy process can really be easily disrupted and cause a lot of uncomfortable symptoms or sometimes more serious health concerns. Also, how formula like our new formula, DigestMate, offers this very powerful digestive solution that naturally you'll find is going to pair alongside with some of our favorites like our Megaspore and MegaGuard. So for a lot of you, this is not going to come as a surprise that digestive symptoms, disorders, they're quite common. 60 to 70 million Americans suffering some type of GI disorder. And often it's not realized that this number includes patients that have been diagnosed with a medical condition. And so in a recent survey of over 71,000 individuals, 1 in 4 adults without a diagnosis of a GI disorder report frequent GI symptoms. And 61% of those adults in this survey reported having more than one GI symptom over the last week. Most commonly reported symptoms are things like heartburn, reflux, abdominal pain, bloating, diarrhea, constipation. Less common symptoms, things like nausea, vomiting, dysphagia, trouble swallowing. So if you're eating too fast or you're a little nervous talking too fast, bowel incontinence. And in this particular survey, as we might expect, females and those with medical comorbidities more likely to experience a lot of these symptoms, which may point us to some of the underlying hormonal and neurological drivers of digestive disorders. And we know these symptoms are risk factors, right? They're underlying warning signs of deeper health issues, but they often have serious impact on quality of life. Nearly 40% of people surveyed stopped routine activities due to their symptoms. So these include things like exercise, running errands, spending time with family and friends. Despite this impact, only a third report discussing their symptoms with their doctor. So a lot of us are normalizing this. So regardless of whether it's discussed or not with the provider, the market shows that people are seeking digestive support on their own, especially in the form of digestive enzymes, with an expected 3.5 billion by 2033. So even over the pandemic, there was an unexpected demand over 2020 and 2021, just showing that people are motivated to mitigate these symptoms and optimize their digestion. So if poor digestion is such an issue, we start by defining what is healthy digestion. It seems simple that We just need to physically and chemically break down foods and liquids into smaller units with ultimate goals of absorption and elimination of waste. Seems pretty simple. Optimal digestion is going to help keep microbes in check and vice versa. They're going to include some key pillars like structurally increasing surface area of the digestive tract, allowing for complete absorption, coordination of proper signaling of digestive secretions, which help control different pH environments required for these different stages of digestion. So if we orient ourselves and think about this process, it's helpful to remember and visualize that it's one long tube that goes from our mouth to our anus. This is our alimentary canal, reaches up to 30 feet in some cases, often with females. They have a longer digestive tract. We also have our ancillary organs, our liver, our gallbladder, our pancreas, and I would argue the brain as being one of the most important. So it can be a very complex process, but helpful to study through the lens of these different phases like cephalic, gastric, and intestinal. So delving into some of these phases, we just take note of many of the breaking points where our digestion may be compromised. So first off, as many of us know, digestion is starting in the brain. So before we even take a bite, it's initiated by our smell, our sight, our taste. Even the thought of food, we know that our brain starts to signal via vagus nerve, preparing the mouth and the stomach for food to be eaten, secreting enzymes like amylase, lipase, lysosome, beginning that breakdown of starch, fats, killing bacteria. 20% of our gastric secretions are regulated in this phase of digestion. So imagine if our brains are distracted and we are in a sympathetic state, we're stressed, rushed, disconnected from the food prep process, and our body skips this cephalic step. So this is often the case. Next step in our journey is that gastric phase. Our food bolus is entering the stomach. It starts to stretch, secreting those neurotransmitters, acetylcholine, histamine, gastrin, which starts signaling the release of a lot of our gastric juices, intrinsic factor, pepsinogen, hydrochloric acid, all working to break down proteins, killing pathogens, also facilitating the absorption of important nutrients like B12 and calcium. Hydrochloric acid, as we all know, plays a very large role here, activating protein digestion. It's starting to kill pathogens. And we know that there's a lot of factors like stress and medications that can disrupt our HCl production. So now that we are ready to leave that stomach, we have what's called chyme. This is an acidic mixture, partially digested food. 95% of our chemical digestion takes place in the small intestine. So chyme entering the duodenum signals the release of those pancreatic enzymes and bile, which completes that breakdown of those carbohydrates, fats, and proteins. The villi of the small intestines containing those brush border enzymes can help capture and break down the larger molecules. The small intestine is specifically designed to provide enough surface area for that complete breakdown and absorption of a variety of nutrients. Therefore, by the time we get to that last part of the small intestine, the ileum, we should have just water, fiber, and some minerals left before we enter the large intestine. So the success of this entire process largely depends on the coordination and signaling between each of these steps. Before we move on, we're going to take a moment. We'll highlight one of the more well-known digestive organs, the pancreas. Often we think about this as the endocrine function of the pancreas, secreting insulin, glucagon, a lot of the pancreatic function that we think about, but most of it is exocrine, producing a lot of our enzymes like amylase, lipase, and peptidase. These are activated in the small intestine. And we know that metabolic pressures and imbalances can exert a lot of pressure on this organ. And so output things like diabetes, alcoholism, MASLD, that's metabolic associated steatotic liver disease. This can all compromise the exocrine function of the pancreas, so often resulting in more serious conditions like exocrine pancreatic insufficiency, which can severely impact on somebody's life. If you know friends, families, or clients that have this, you know what I'm talking about. So if we go back to these enzymes, reviewing the enzyme structure and function. So these are simply a type of protein molecule. They're purposed for catalyzing and initiating chemical reactions. Our bodies use and are currently using thousands of these enzymes every day, every moment, and they're divided either into these metabolic enzymes or digestive enzymes, or enzymes that naturally come from whole foods. Today, we're going to be focusing on, of course, digestive enzymes. So these are designed for breaking down carbohydrates, proteins, fats. For example, amylase, both salivary and pancreas, degrades carbohydrates into glucose and smaller mono and disaccharides, whereas lipase, of course, breaks down triglycerides into those respective glycerols and fatty acids. And really, these are operating kind of like a lock and key method where specific enzymes bind to its matching substrate, be it a protein, glucose, or fructose molecule. And another way that this has been described is like scissors snipping the chain of molecules, thus liberating and activating smaller substrates. And this mechanism results in tiny absorbable micronutrients like amino acids, monosaccharides, triglycerides, and these are meant to easily pass through our gut lining to be utilized. So simple goal, yet very complex journey. All right, moving on. So again, simple goal, complex journey, a journey that travels the expanse of 30 feet over the course of 24 hours, traversing varying compartments with different pH levels, microbial compositions, relying on the assistance of all these ancillary organs. And all of these variables need to come together. So what could possibly go wrong? And it turns out there's many things that can go wrong, many things that can drive this digestive insufficiency. First and foremost, we have stress. If we remember that this whole process is dependent on nerve signaling, most of us are experiencing less than ideal digestion because we're mindlessly eating or stressed out during meal times, eating in front of screens while distracted. This is just the norm these days. And this is going to block some of that critical signaling of those digestive secretions like HCl and enzymes. And in these moments, we're likely not practicing mindful eating, like chewing, sitting down, eating consistent meal times. And we're on the go, we're drinking our meals, we're bypassing chewing altogether. And we know that poor nutrition is going to be one of those main drivers of any gut issue, but we may not always remember that whole foods also provide those exogenous sources of plant enzymes that are going to help break down some of those same foods. Also, there's several common medications that can disrupt digestion. So certain blood pressure meds can slow motility or have been linked to the development of diverticulosis. PPIs, proton pump inhibitors, of course, disrupt some of those critical functions of HCl. And then we also have other types of medications that can affect the malabsorption of calcium or cause infections like C. diff. Chronic NSAID use can cause the degradation of intestinal mucosal layer. And we also know that certain IBD meds have been associated with pancreatitis. So we are not surprised about this as nutritionists, whole food versus processed food, but we do like to see this continue to be researched and validated and for us to encourage whole food consumption. So this is actually a newly published human study where they demonstrated the metabolic consequences of ultra-processed food. So the more processed the meal, of course, the sharper the postprandial spikes and dysregulated hormonal response. Whereas, surprise, surprise, whole foods led to better and more gradual digestion and prolonged satiety. So really improving a lot of these neurotransmitters and peptide hormone markers. Again, we know this, hopefully we're teaching this, but it's really good to see this validated. So there are also a lot of common clinical conditions that we want to consider of digestive dysfunction. So EPI, as mentioned before, low stomach acid, this is going to disrupt that pH that will disrupt other downstream signaling to the liver and the pancreas, affecting bile and enzyme secretion. Intestinal inflammation can impact those secretions. In metabolic dysfunction or metabolic endotoxemia, fatty liver, when we have chronically high insulin, this is going to compromise pancreatic function, as mentioned before. When we have cholestasis, we have impaired bile flow, also really common in cystic fibrosis. This can impair pancreatic, hepatobiliary, and intestinal function. And then any condition that has the potential to alter that gut-brain communication, like Parkinson's, MS, Alzheimer's, TBIs, also have higher rates of digestive insufficiency. So you often see poor digestion in some of these signs and symptoms along with gut-brain dysregulation. So these symptoms can range from the very obvious, things like excessive gas, abdominal pain, to all the way to brain fog, skin rashing, increasing food intolerance. SIBO, we know, is another sign of insufficient digestion. And if food is not being broken down or absorbed sufficiently, it becomes a substrate for our microbiome, causing overgrowth. And we know we need to nourish and feed our microbes very well, but we know that they also require a balanced diet to maintain population control. So we can do a lot to improve our digestive health. We can make dietary changes, we can improve our eating practices, pay attention to oral hygiene, manage our stress response, take a few deep breaths before a meal. We know that that can even help, touching, smelling your food. But we also know we can incorporate supplements like enzymes and probiotics that can go a long way to assist. And this is where Microbiome Labs' newest edition, DigestMate, really comes into play. This is a universal digestive formula that long awaited. And it's going to aid in the breakdown, absorption of food, supporting really a wide variety of dietary choices. And it has quickly become part of our first line recommendations, like Shivan said before, for GI distress and dysbiosis. And so this formula, this is a unique blend of 14 different enzymes combined with 3 strain probiotics. So our B. subtilis HU58, Bacillus coagulans SC208, Saccharomyces boulardii. And this is a powerful synergy of enzymes and probiotics, which really serves to provide this multi-mechanistic support for digestion and microbial balance, again, for a really wide diversity of dietary choices. So if we dig into some of these probiotics here, so HU58 and Bacillus coagulans SC208, these are tried and true, familiar spores to us. They're in megaspore, and we know they're clinically shown to reduce inflammation, provide antimicrobial support, improve microbial diversity, all functions which are crucial for digestion through modulating immune response, strengthening that intestinal barrier. And we know that intestinal inflammation can cause dysregulation of enzymes and bile acid production. So we want to maintain that immune homeostasis, which is really a foundational aspect for digestive function. And Bacillus coagulans specifically are extensively studied for multiple purposes, including that digestive function, producing metabolites like lactic acid, short-chain fatty acids, butyrate, acetate, propionate. Coagulans also contribute to digestion and absorption through the production of their own enzymes like galactosidase, amylase, lipase, and protease. So it has pretty widespread benefits, and it's also been studied and shown to reduce abdominal pain, bloating, thus improving a lot of those overall quality of life scores. And additionally, Bacillus species can perform extensive functions. There is emerging research right now on the ability of these bacteria to degrade gluten, which is pretty exciting. Studies over the last 15 years have shown that indeed Bacillus species are among some of the species that participate in gluten digestion. And in some studies, they have activity towards that gliadin peptide, considered some of the most immunogenic protein fragment in gluten. So that's very exciting. And then that third piece of the probiotic blend is Saccharomyces boulardii. This is a beneficial yeast, resistant to stomach acid and bile salts. And a lot of us are familiar with Saccharomyces boulardii for antibiotic-induced diarrhea or candida. And we know it's very pleiotropic. There's studies showing it reduces mucosal inflammation, enhances brush border enzyme production and glycoprotein release. Also, a lot of immunoprotective mechanisms, including increasing secretory IgA, reducing pro-inflammatory cytokines, and increasing anti-inflammatory interleukins, so IL-10. So after covering that, let's move into our enzyme blend. And just a quick review of enzyme dosing and labeling. Most enzymes, you'll notice, they're, rather than being labeled by weight, by like milligrams or micrograms, you'll see the letters U. So this indicates activity unit. This is because enzymes are measured by activity rather than weight. And activity is just the rate at which that enzyme can catalyze a reaction. In the case of digestive enzymes, it's how quickly that enzyme can break down a specific substrate. So take lactase, which is measured in acid lactase units, indicates the activity level at which it can break down lactose sugar. So the activity level can be impacted by environmental temperature, pH levels, and also just the sheer amount of substrate that needs to be catalyzed or broken down. So indicating that we want to have a very well-balanced diet between our macronutrients. And these enzymes can be animal or plant sourced. Often these are going to be known as microbial or fungal derived. And even though animal derived enzymes represent sort of the main standard of care for digestive health, there's growing research for microbial enzymes, and for good reason. Fungi naturally contain a lot of enzymes. They produce a lot of enzymes like protease, amylase, and lipase, cellulase. Whereas animal-based enzymes are a little bit more limited. A lot of times it's protease. And fungal-based enzymes are also shown to maintain their stability throughout changing pH levels. So they have flexibility and potentially showing and allowing them to activate more quickly. There's also some research to show that they don't require very high doses in order to reach some of the efficacy, the same efficacy as animal-based enzymes. So it's also partially why you might see lower activity levels versus animal versus microbial-based. Typical sourcing of these enzymes is going to be from Aspergillus species. A lot of people see that word and they'll often have concern about mycotoxicity or mold exposure. And these fungal-based enzymes have been used throughout human history. They're widely recognized as safe for human consumption. And during that manufacturing process, it's important to know that finished product contains only highly purified enzymes, does not retain any of mold or mycotoxicity, so of which they are grown. So we don't have any concern about that mold exposure here. And if we're looking at some of the digestive enzyme research, a lot of it, digestive enzyme therapy, is limited to EPI or more common food intolerances such as dairy or gluten-specific carbohydrates. And two of the most popular over-the-counter digestive enzymes sold target that breakdown of lactose and fiber. And this makes sense. 75% of individuals worldwide experience some degree of lactose intolerance. And several studies show symptom improvement after supplementation with lactase. So they show reduced hydrogen exhalation. And in this one study, lactase supplementation alone led to improvements, but it was the combination with yogurt, which contains enzyme-producing bacteria, that yielded the best outcomes. So again, pointing to that synergy between supplementing with both enzymes and probiotics. Also, fiber. So fiber is, again, another common challenge. And if we're looking at some of these prebiotic fibers like lacto-oligosaccharides, we have alpha-galactosidase. So this is also found in FODMAPE, as you might be familiar, and it's well studied for its ability to reduce symptoms like gas, bloating that can come from ingesting these prebiotic fibers. So currently the research on plant and fungal-based enzyme therapy, it's not as robust as animal-based. Because of that, this particular study actually set out to demonstrate the efficacy of microbial enzymes. So this is performed using an in vitro infogest simulation model. This mimics the different stages of digestion, including our cephalic, gastric, and intestinal. And this was using a blend of 6 fungal enzymes, and that was used as the treatment. And the blend was administered, tested under normal GI conditions, and improved the breakdown of all major macronutrients, plus enhanced release of amino acids, indicating improved nutrient absorption. So they also simulated compromised digestion, so like aging or chronic PPI use in this model. And in each of these compromised models, the enzyme blend was also shown to improve salivary and gastric stages of digestion. So we know individual enzymes have been researched for degrading gluten protein, but the combination of enzyme therapy has also been studied for non-celiac gluten sensitivity, which has increased over the last 10 years. So that doesn't surprise any of us, right? And people with non-celiac gluten sensitivity often experience similar symptoms like fatigue, headaches, joint pain, GI distress, which seem to go away once gluten is removed from the diet. But we know gluten-free is not always possible for everybody. It's difficult. And digestive enzyme blends like this can really help in managing these symptoms. So there is evidence to support the enzyme blends of these different peptidase and protease. They work together to degrade gluten protein. So these are a couple of studies that help support the use and efficacy of fungal-based enzymes that all work better in combination rather than as a standalone, specifically for digesting gluten. So really understanding how widespread digestive issues are, how easily it can be disrupted. We see there's a really universal application for something like DigestMate. So anyone experiencing these conditions and symptoms of digestive insufficiency. So multiple food intolerances, people who might be struggling to adhere to that strict low FODMAP or AIP or SIBO diet. Those populations are also sometimes prone to malabsorption, our aging population as well, or people with chronic inflammatory or autoimmune conditions. DigestMate really has become, like I said, a fast go-to for our SIBO and IBS patients, pairing perfectly with our Megaspore, Biotic, and MegaGuard. And there's a lot of situations where digestive support can be beneficial, even inflammatory skin conditions like eczema or rashing. And for those with compromised gut-brain function, including Alzheimer's, autism, TBIs, that's where I often find it very, very useful. And those experiencing chronic or acute stress may need extra digestive support during that season. So, especially when traveling or during the holiday season. So this is very universally applicable. And this is how we might pair these products. I know you guys will get the slides here, but this is a combination of DigestMate, MegaGuard, Megaspore, Megamucosa, very strong but easy to use protocol that eases digestion and supports macronutrient breakdown, and really just very broad support for overall digestive comfort. We recommend 2 capsules with each meal. Use as needed. This is very bio-individual. If someone's following a 2-MAT kind of plan, they might choose to use 2 capsules with their larger meal, 1 capsule with their smaller meal. So again, we want to modify based on the individual, based on their diet, based on their frequency and eating pattern. But again, we have 2 out of 3 Americans that face digestive issues, and there's a lot of different causes for this, but we have really innovative tools and strategies for improving and optimizing this part of life so that we can enjoy our meals and happily digest. And that is what I have for you guys today. And I know that that was a lot, but I hope that you learned something about our new product here. And Shivan, I'll take any questions that you might have.
Jenny. Hey, Jenny. Thank you. Sorry, I couldn't hit the button fast enough. Thank you. Happy digesting to you too. Go ahead and come full screen for us.
You got it.
Let's put some love into the chat for, let me open it up for Jenny. That was fantastic. That was fast too. I know you talked fast today. So if anyone wants to watch the replay, you can play it on a little bit slower speed. And I loved it. So that was fantastic. Thank you so much. It was a lot to get in, and you nailed the half-hour mark. Love you for that.
It definitely, digestion is such a very big topic, as I'm sure you guys all know, and there's so many different angles to try to get in there, but hopefully we hit the high points for everybody.
You did a great job. You showed the anatomy. That was a great overview. So one thing that I just want to let everybody know is that if you do decide to purchase anything from Microbiome Labs tonight before 8 p.m. Eastern time, if you're here watching this live, July 22nd, 2025, then you get her slides. Not before. That's just like a bonus for fast action. And then also it is 15% off on everything at Microbiome Labs, thanks to my relationship with them, with coupon code, or patient direct is a better way of putting it, SIBO SOS. If you click the link in the chat, it does take you directly to that, and it should already be populated for you.
And there's bonus slides in there too that I sent to you guys. So
oh, thank you. I love that part. Thank you. And then also I wanted to share my screen quickly, and then we're going to get to your questions. This is the masterclass that if you also send in by 8 p.m. Eastern time tonight, your receipt to info@sibosos.com. It's in the chat. A wonderful masterclass. It's normally $59 on its own, called How to Achieve Perfect Digestion with Dr. Mona Morstein.
Problem, but there's no stones.
She talks about all the tests you can take, digestive enzymes, consequences, hydrochloric acid. I'm just whipping through here. More enzymes, causes of GERD. She is a incredible naturopath who has taught in natural health colleges for over 30 years. She's just a really phenomenal healer. and knows secret things. So what I find for Mona is that she's an assertive healer, and she also knows things that so many other people don't know from her vast experience and teaching for so long. So anyway, that would be the other bonus if you did decide to purchase anything from Microbiome Labs by 8 p.m. tonight using our code. And then do send in the proof of purchase tonight instead of like in 3 days, so we can get to you the links and etc. Okay, here come some questions for you. And by the way, anybody who has a question, do put it into the Q&A box and not the chat. Thank you. Okay, here we go. At what stage of eating do you take these, and dosage for, like, do you take it before, during, or after the meal?
Yes. You know, sometimes I get this question because people are going, oh, what if I forget? And there is some flexibility. Ideally, yes, we take it before. We take it about 10 minutes before a meal. Ideally, that's what we would want. However, I can tell you that I've taken this mid-meal because I've forgotten, and I can still feel the difference. So we know that the spores are going to be very robust as well. So yeah.
Okay, and so that's kind of dovetailing into Maria's second question. If you take these, when is the best time to take Sporebiotics?
So this is actually a really good question, a common one that we have gotten, especially when people are taking, commonly, they're taking both Megaspore and DigestMate. So DigestMate does not have a lot of spores. So there's about 1 billion of each of those strains. So if I am taking both of these, I'm still going to start, I'll start with DigestMate first. Because that's really what I want to get on board first for that quick relief. And then start adding in that Megaspore as you would normally. We recommend that titration. And you can build up, you can add those spores, but that's how I would do that. So I would be taking, if I'm taking DigestMate, 2 capsules, let's say I need it for every single meal because I'm that symptomatic, then I may be starting with 1 Megaspore a day.
Yeah, build up slowly if you're new to it. What does she mean by yeast form? I know you already addressed this, but would I have issues with DigestMate if I'm highly sensitive to yeast?
Another common question that we've gotten. So this is also one that it's a pretty low dose of the Saccharomyces boulardii. And in the case of very severe sensitivity, some people are avoiding this Saccharomyces boulardii potentially, but I have found in a lot of cases, even with yeast sensitivity, once I'm restoring the gut, I'm really, the 1 billion of Saccharomyces boulardii is pretty well tolerated. So again, you might start with just the 1 capsule to kind of half that dose. But I think it just depends on the severity of that sensitivity.
Okay. I've heard that, if you think you have candida, it's fine, but yes, you have to test it for yourself. What about the need for HCl or pepsin? Hi, Christy.
Yes. So we found there's a reason, we've gotten that question as well. Why didn't we include HCl? And there's a lot of cases where people may not use HCl. Their patients may be sensitive to it. And so we want to give people that option. You can certainly add HCl on top of this product. A lot of people do it with the need for it, but yeah.
Why would someone feel nauseous after taking enzymes?
Well, I would first ask about if they're taking it close to a meal. And make sure that it has been close to a meal. It could be a variety of things. There's some enzyme products that have a very high activity, and so you might be moving a lot, and there's a lot digesting that you are not used to. Again, if you took it on an empty stomach, then activity completely changes. We know that the empty stomach, they're going to start working more proteolytically. And so this is a little bit more detoxifying. So those would be some questions I would ask first about that. Okay.
All right. Which products would you recommend after upper and lower GI testing?
So just testing, no results, specific results?
Just as which products would you recommend? I think after upper and GI and lower GI testing, like after you cleaned everything out for the, the prep is what I'm thinking.
Okay, so restoring and restoring your microbiome. I actually like the digestion protocol that I included in here. So this is the, let me pull it up here on my screen just to remind myself, but it's DigestMate with
You want to share your
MegaGuard.
screen so everyone can see it?
Oh, yes. Excuse me. Just get it up here. Make sure that you guys can see it. Let me know what you see.
Right now it's just black. There you go. Oh, you're gonna have to, it's just the last slides.
Oh, yes. Okay. Yeah. Let me go back. Oops. Oh, yeah. So this one,
Yeah.
I really like this protocol. It's also very gentle. We are using the MegaGuard and the DigestMate with the Megaspore and the Megamucosa. The Megamucosa has a little bit of that IgG. So really, this is a great restorative protocol after those
Let's see.
tests.
All right, DigestMate, MegaGuard. Okay. Okay. And then Megaspore. Oh, I see. Megamucosa. Got it. Megamucosa. All right. All right. So it's the Megamucosa comes in both capsules or powder. So you've addressed both of those. All right. Okay, cool. Thank you. All right. Which products would you recommend? Okay, we just did that. And then can you take for SIBO along with Megaspore? What are your thoughts on that?
Oh, yes. Is the question, can you take Megaspore if you have SIBO?
Yeah, and also can you take DigestMate?
Oh, yes. Again, like I mentioned, this, even though we haven't updated our SIBO protocol, when we do update, it will definitely include DigestMate in our SIBO protocol. Absolutely.
Remember, those enzymes are the first thing that most GI doctors are going to talk to you about, or most naturopaths, or most nutritionists, etc., because it just helps with it. It helps with so many things, and as you get older, you lose certain enzymes or the amount of robust enzymatic activity. Let's see, DigestMate with high LPS. Is that okay?
Yes, in fact, it would be preferred.
Lipopolysaccharides. Just explain what that is, if you would.
Absolutely. We love, that's probably one of our favorite topics is LPS. So lipopolysaccharide, this is a fragment of primarily gram-negative bacteria, and often it becomes elevated, it can damage and cause leaky gut. And if it gets into the bloodstream, this is what we call metabolic endotoxemia. And this is actually originally, Kiran set out to solve this problem specifically. And just so you know a little bit more about LPS, that's what they use in research to induce inflammation. So if they need to create an inflammatory model, they use LPS. So if we know that this is also a problem and it's leaking out of our gut, how do we solve that? We know Megaspore has several studies, specifically its flagship study that within 30 days, it can lower postprandial rise in LPS. So we know that these spores can help to lower that burden of LPS while we are healing and sealing the gut, correcting the diet, correcting a lot of these lifestyle factors that create a higher LPS load.
Okay, and what other microbiome lab products for lipopolysaccharides?
Right. So this would be
Megaspore.
Megaspore, also IgG. We don't want to forget about Mega IgG that can specifically bind to LPS. It can bind to a number of different toxic metabolites, including aflatoxin, but its claim to fame really is binding to LPS.
Can I take DigestMate if I have a very high secretory IgA and anti-gliadin IgA?
Yes, I would recommend it.
Okay.
Yes. Usually this is going to be a case of where we have high intestinal inflammation. And again, it's going to be part of those first line treatments that you want to be doing.
And of course, this isn't medical advice. Talk to your providers. This is just like guidance and information for you to consider into your, protocols. Jenny is not your nutritionist or your doctor or anything like that. I know you all know that, but I just feel like it's appropriate to reiterate when we get such personalized questions, and we're glad that everyone's here curious and asking and learning. I don't have any more questions in the Q&A box, but what test should you do if you are having bloating and pain when certain foods are eaten? Well, I would definitely suggest a SIBO breath test to see if that is part of your situation. And if that's negative, I would get a stool test done. What about you, Jenny?
Yeah, so I think that you certainly the breath testing, we love to just quickly determine where to go and how to intervene. We also, as you know, at Microbiome Labs, we do the Biome Effects stool testing, which is whole genome sequencing, where we can really see a lot of the digestive patterns, in fact, and see, what are your microbes doing with your food? So there's certain parts of that stool testing that include saccharolytic and proteolytic fermentation, where we can really understand, okay, where are we having issues? So I think that those two types of tests can really tell you a lot. And you can consult, obviously, with an outside, like with your provider, of course.
Of course. Okay, that's it for the questions. Oh, one more just came in. Which of your products do you recommend for detoxing and or helping mold and mycotoxin colonization?
So in terms of the Microbiome Labs products, I would really be looking at something like Megaspore, specifically Mega Marine. Mega Marine this is a omega-3 fish oil that also has pro-resolving mediators, can go a long way to mediating intestinal inflammation. And then Mega Mycobalance, and I think we might have talked about that earlier, but this actually has that undecylinic acid and B-propolis, because we know that alongside mycotoxin, we can also experience a lot of candida overgrowth as well. And then, of course, Mega IgG. So those would be some of the targeted products. And then, of course, do your other binders and mitochondrial support for mold toxicity and remediate or move all the things.
Remediate or move. You can check out Dr. Jill Krista. Her site is phenomenal for educating people about mold and what to do. And also she has a list of providers who are mold, have taken her mold courses. So she's got a great blog, on and on and on. So Dr. Jill Krista is my go-to for that. I also like Bridget Danner. If in Canada, can I still do the test with you guys?
Oh, in Canada, excuse me. No, not right now. We are working on it, but not at the moment.
Okay. It's Dr. Jill Krista. I'll just it's just the name of her site too, Dr. Jill Krista. So someone was asking me if we're going to post the link again to how to order. It's right there. I'll just repost it. It's in the chat. You can't miss it. Maybe you can. It depends on how it's showing up on your phone, etc. There you go. And there you go. Okay, we got Dr. Jill Krista. But I want to just comment about how when I'm hearing you saying the formulations like propolis and some of these really different ingredients. Mm-hmm. So Microbiome Labs doesn't just go, oh, let's do vitamin C. Oh, let's do vitamin whatever, alphabet soup. I mean, they are very careful and very curated about what they do. Megaspore is the most popular, or at least one of the most popular probiotics in North America. It is something that I could not find and buy myself when I first heard about it. And I looked and looked and looked. And so I'm so honored to be able to share it with you all, because it's not always available. And I wouldn't ever buy it on Amazon. I buy a lot of things on Amazon, but I don't buy my supplements there that I can buy directly from the manufacturer. Lots of reasons why. And they're just extremely careful, and they only want to do things that are really going to work. So they're not just like, let's do a supplement and have a parade. They're extremely strategic, research-backed, very careful about making sure that the formulations that they bring to you are ultimately unique, seriously, and like really task specific. They have things for sleep, they have things for mood. So go there, check out the website, poke around. Also, if you do order a microbiome test or for the stool or the vaginal, you will have to take that to your own provider to have it interpreted. That is not included in the purchase of the test. So one time I had one woman who was very confused about that. She didn't let it go. We finally resolved it. She didn't listen to what I said. So I'm saying it now. It is not including interpretation. You will have to take it to your own provider. We will not be giving you a list of providers. La, 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 la. So, however, the reports are very, very good. And, if you are a savvy patient, which I would assume most of you are, then you can do a lot, but also take it to your provider, for goodness sakes. I love the idea of walking into medical appointments with my test already done, so I don't waste that first appointment, because then I'm like, okay, yeah, okay, nice to meet you. Great. We're having our first appointment. Okay, now here are the tests you want to do. Okay. All right. Then I have to get the test and then go for another appointment. So anytime I can walk in with, or do Zoom or telemedicine with some results already, I think it really does, for me personally, it moves me forward more quickly. All right. With that, I want to say, Jenny, thank you so much. Let's go ahead and put some love into the chat. Any aha moments that you have would be so appreciated. Like, have you all been overlooking enzymes? Have you ever considered doing enzymes? This is the first time you're like, oh, that's interesting. Enzymes. Okay. Think about what they do, how they are used in industrial applications, in laundry, how they like eat things up and they help break down things. So if your body isn't breaking down foods properly, and you're like, I'm just, feeling really like I have a lot of food sensitivities. Sometimes, not always, I wish, but sometimes it's simply that you don't have enough digestive enzymes, and that those can be pretty miraculous. There's no downside really for grabbing them and trying them. With that, I want to say thank you so much. Why can't you take FODMate long term? Kathleen wants to know.
Why can't you? It's not that you can't necessarily. It's that you don't. We don't want you to need to take that long term. Ideally, what we're doing during that process, if we're following a low FODMAP or low fiber diet, we are working to restore gut functionality. We're restoring that microbiome so that we can expand that out. I would say FODMate is a little bit more temporary, whereas the DigestMate, a lot of people, they're going to find that this can become part of their daily supplement regimen. You'll notice that the activity units are going to be a lot lower for DigestMate versus FODMate. FODMate is very targeted, like Shivan said. This is a very targeted product, whereas DigestMate's targeted for our daily support.
There you go. And with that, Sadie says, I love you, everybody. All my meetings, she's been showing up, and I've been talking in doggy voice pretty much nonstop since we got her.
I love the furry friends on our webinars. I love it.
I love it. Thank you, Jenny. Thank you, everybody. I so appreciate all of you. And we will keep you posted and what else is coming. And we'll send out the replay tonight. And we've got a lot of wonderful things planned for you over the next couple of months. So be sure to keep opening up those emails, and we'll catch you next time. Mwah! Thanks, everybody. Right, Sadie? Right. Bye.
Thank you. Bye.